Access to healthcare in Malaysia. Malaysia, located in Southeast Asia, is a land of contrasts. With over 33 million inhabitants and divided into West Malaysia and East Malaysia, it combines modern cities like Kuala Lumpur with vast rainforests in Sabah and Sarawak. West Malaysia, the economic heart of the country, offers modern healthcare with well-equipped hospitals and specialists in urban areas. In the remote parts of the country, however, the reality is different. Communities such as the indigenous Orang Asli in West Malaysia and residents in the mountainous regions of Sabah face limited access to healthcare. Poor roads and a lack of medical facilities often make assistance inaccessible. Initiatives like mobile clinics aim to bridge this gap. In this documentary, we explore these inequalities. We showcase how healthcare functions in the modern cities of West Malaysia and highlight the ongoing struggle for better access in remote areas like Sabah and other parts of East Malaysia. Our goal is to raise awareness and give a voice to the communities that need healthcare the most.
This clinic? Basically, is a easy access, if I can say, because our clinic kesihatan is one of the biggest clinic kesihatan in our district, Gombak. Okay, and we are assessed by the public transport, and basically all the population here that come for the visiting age around 30 to 70 years old. So the access is actually quite easy. They have the accessibility through the public transport by their own vehicles, and we do also by the commuter itself. So it's easily accessed by any other ways around. More about that. It's actually cheap. We call it a cheap amount that you have to pay for your health. Lah. Okay, basically in our Malaysian setting, all the clinic kesihatan, they only need to pay RM1 for all the service that we provide here, no additional charges. For those pensioner, government pensioner, they will get the free benefit. They don't even have to pay for that RM1. So the access that they could get here, despite the treatment, the medication, even though for the medication, like routine medication for diabetic hypertension, cholesterol treatment is also free. We can call it free lah. They just come pay for RM1 for registration. They will get the supply of medication up to 6 months, basically. Okay, so additional procedures such as maybe venipuncture, any nebulizer given, or any additional injection that you need to take from the clinic is also free, including for the maternal health care. The immunization is free for the for the children. The immunization for the mother, the checkup, the scan, and everything is free. It's only RM1 cost. You can get everything under clinic kesihatan. I don't think so. I think because the payment, the service, now is very easy for you to get. Even though the appointment system for now, they can access through internet of online, so they can decide which clinic or which hospital they want to go and what time they want to go. So it's very easy. Once you have the appointment, you just come and then just show us the appointment date that you have booked, and then we will see you lah.
People can choose between public and private services depending on their ability to pay. Patients have little choice of doctor in the public sector, since this depends on the availability of clinicians working on a given day. People can choose their private doctor and also their specialist without needing a referral, with waiting times much shorter in the private than in the public system. People generally have good physical access to health facilities, as 92% of the urban population live within 3 kilometers of a health facility and nearly 69% for the rural population, although distances are greater in East Malaysia.
The medication actually is good, uh is more than satisfactory, because when we go to the private sector, you have to pay for RM50 for antenatal checkup. Right now, right here, in KK, you get it for free, and it is included with medication. The doctor will prescribe you with Zincofer or Obimin, and I think actually government hospital is good enough. Yeah. And right now, they are currently boosting on mental hospital for mental health. And I have before this, the previous pregnancy, I got this quite what they call anxiety, and the doctor treat me right away. I can meet the psychiatrist. So I guess that is a very memorable experience to me, when your mental issues being heard right now. Yeah.
Sabah is one of Malaysia's most picturesque states and also a home to some of its greatest healthcare challenges. Rugged terrain, poor infrastructure, and an acute shortage of medical personnel create a harsh reality for residents, particularly in rural areas. Till today, more than a third of the population in Sabah continue to live beyond 5 kilometers of any kind of health facility. Due to a lack of specialists and medical equipment, patients seeking treatments or follow-up treatments are often forced to refer to another public hospital that could cater to their respective medical needs.
So access to healthcare in Sabah will be with if we want to compare it to the cities, not just Sabah specifically, because certain cities in Sabah they do have public transport, but it's still a limited number or types of public transports when comparing to Kuala Lumpur. But in the rural area of Sabah, public transport there's no official public transport that I know of. So what the locals here use is what we call as pirated transporter, meaning the individuals that has vehicles, they will charge, they will provide their service to use their vehicles for a certain amount of fees to bring the villagers or the people that wants to use his service to go anywhere they want. So
For her, there's no issue for her to go to klinik kesihatan Narandam, but for her to go to appointments in the hospital, for that in the town, there will be a real challenge for her, as she don't have the proper transport to go there. I think from here to there is approximately 1 hour.
okay.
So here's the problem. In case of emergency, she has no choice but to wait for her husband, who only comes back once a week. So that's why Dr. Cindy asked, even for emergency cases. So I asked her, what about your family surroundings? She said that family has a little bit of an issue to help her. She has no choice. Even through emergency cases, she has to wait for her husband to be back once a week. It is very difficult for her, but she has no choice because she doesn't have the license to drive anymore. So she has to depend on her husband.
Okay.
Yeah. If it's not only for her, but majority of the villagers here have the same issue with transports. So they have another solution, which is a rented car, but due to low socio-economic factor, each time they rent a car, it costs 150 ringgit.
Around 30 euros.
Yes.
Which is a lot
For them. And it's just one way. And it's another 150 back, so it's 300. For her, she said currently she's not paying anything. It's free for her and she's very happy.
Okay.
Yes. She's very, very comfortable with that.
Semua friendly.
Yes, very friendly, she said. Yes. So for her, she hopes that our government can provide transport in helping to bring them, which is an emergency, to hospital so that immediate treatment can be given.
Access to healthcare is available to many, but for the Orang Asli, both access and perception remain significant barriers. While some avoid seeking care due to cultural beliefs or a lack of understanding, others face challenges due to the remote locations of their communities, which makes traveling to clinics difficult. Healthcare workers visit periodically, and in emergencies, the Flying Doctor Unit provides essential services to areas that cannot be reached by road. Cultural barriers, including a deep trust in nature and spiritual beliefs, further complicate the situation. With 18 subtribes and a lack of healthcare workers who speak the various languages, communication is a challenge, and this sometimes leads to hesitation to seek healthcare. To address these issues, improving health literacy is crucial. Educating the Orang Asli about the importance of medication, preventive care, and general well-being can help them make more informed decisions about their health, fostering a greater understanding of modern healthcare practices. Another initiative to make the access to healthcare easier are the mobile clinics. Mobile clinics are a vital healthcare solution in Malaysia, especially for rural communities that are difficult to reach. These clinics bring essential medical services directly to remote areas, bypassing the challenges posed by poor infrastructure and long travel distances. Mobile health teams, supported by partnerships with organizations like UNICEF, help bridge this gap by providing healthcare, including medical checkups, dental care, and health education, right in the heart of these villages.
But you see here, we do come to a place where there is other event going on. So there was a huge kind of like market, which is a big thing actually. This market is like people from other area, other than the Simpang Renggam, also come here because they sell quite expensive stuff lah. So they come here and then they see the mobile clinic. So that's one way of us trying to approach them. So when they come, it is definitely a free service. So we come basically to identify several things. One is to make sure that their care is actually up to date. So you find out that they haven't been following up and so on. So you want to establish, you need to go back to your health clinic and then identify any acute problem that has been brewing, but they have not been seeing their doctor for consultation. So that's basically what this mobile clinic is meant for.
Improvements in Malaysia's healthcare system, especially in rural and underserved areas, are critical for addressing gaps in accessibility and quality. One of the key advancements is the expansion of mobile clinics. These clinics now need to offer more comprehensive procedures, a wider range of medications, and increased safety measures. A larger, better equipped mobile clinic with diverse services would significantly improve preventive care and ensure that rural populations have access to essential healthcare services. Moreover, in high-risk areas, the government is working to address the need for emergency transportation. Many rural residents still face challenges in reaching hospitals quickly, and providing transport for emergencies could save lives. The government's role in supporting this infrastructure is vital for improving timely medical care. Equally important is the push for greater health literacy. Many communities need education on the importance of taking medication correctly and maintaining general well-being. Raising awareness about healthcare practices is crucial for improving long-term health outcomes and preventing unnecessary hospital visits. In urban Malaysia, healthcare systems are advanced, offering modern services. However, rural areas still face significant challenges. Mobile clinics play a key role in providing essential healthcare, but they lack the resources of urban hospitals. Emergency transport services are crucial for ensuring remote patients can reach healthcare facilities quickly. Despite improvements, barriers like cultural differences, language issues, and geographic isolation persist, particularly among indigenous groups like the Orang Asli. Efforts to improve health literacy are essential to raise awareness about medication adherence and overall well-being. Our research spans diverse healthcare settings, offering insights into both urban and rural healthcare systems. However, limitations include the inability to directly interact with patients in some remote areas, particularly indigenous communities such as the Orang Asli. Conclusions are based on interviews and observations that highlight clear disparities in healthcare access between urban and rural regions, emphasizing the need for improved mobile clinics, emergency transport, and health literacy. Key improvements should focus on expanding mobile clinics, enhancing emergency transport, and boosting health literacy, especially in underserved rural areas. There is a need for better roads for access to healthcare in rural areas. These actions are critical to closing the healthcare gap between urban and rural Malaysia.